Hello, everyone. Thank you for joining us today on the first session of the GESI webinar. I'm sorry, I think we're experiencing some connection trouble. So today on our first session of the GESI webinar, we have Elial and Rasha Fadlallah from the Spark team, who will talk about the Spark prioritization tool. Throughout this session, there will be some polls. You are highly recommended to participate in the polls to give your feedback, and we will definitely open space for discussion or any questions. If you have any urgent question, please choose the raise your hand option, and I will try to follow up with everyone who has questions throughout the webinar, or we will wait until they finish the Spark team finishes their presentation so that we go through the answers. Thank you.
Hello, everyone. Hello, everyone. I'm Rasha Fadlallah, and I'm a systematic review lead at the Spark Center. I will be presenting about Spark prioritization tool along with my colleague Eli Ael. Hi, Eli.
Hi, Rasha, and hi, everyone. So my name is Eli.
Okay, so we will take the first 15 minutes to introduce the Spark tool, and this will be followed by open discussion and feedback on the tool. Feel free to ask questions as we go along. Just a brief background. The Center was founded in 2013 through support from the Alliance for Health Policy and Systems Research at the World Health Organization. We specialize in the production of policy-relevant evidence synthesis products with a focus on health policy and systems research. And we were recently appointed to host the Secretariat of GESI. So why health policy and systems research? You may know health policy and systems research can strengthen health systems, drive progress towards universal health coverage, and help deliver the promise of better health for all. Systematic reviews of health policy and systems research can be of great help to decision makers as they constitute a more reliable and robust source of evidence compared to individual studies. So groups or centers like Spark conducting systematic reviews in health policy and systems research should ideally prioritize topics according to the needs of policymakers and stakeholders. Priority setting is important for many reasons. It allows us to respond to the needs of policymakers and stakeholders. It increases the likelihood that health policy decision is informed by the best available research evidence. It helps optimize allocation of scarce resources to those priority areas that will likely yield the most benefits. And of course, it helps maximize the impact of research by aligning the research question to policy priorities, and it helps avoid research waste. Existing priority setting and approaches focus on priority setting for health research in general or in the clinical field. There are no existing tools or approaches for prioritizing questions for systematic reviews in health policy and systems research. So in an attempt to address this gap as well as promote policy-relevant evidence synthesis products, we took the initiative to develop Spark tool. And we followed a formal process that involved the following 4 steps. We defined the purpose and the scope of the tool as follows. So the tool is intended to prioritize questions of health policy and systems research in order to address them in systematic reviews. And ideally, the tool is used during formal processes such as priority setting exercises. However, policymakers and stakeholders can also use it on individual basis For example, when a formal priority exercise is not feasible. And of course, the tool needs to be used independently for each review question being considered for prioritization. For item generation and reduction, we conducted a comprehensive literature review which identified 40 relevant articles. Members of the research team with expertise in systematic review methodology and in health policy and systems research then abstracted potentially relevant items from these 40 articles. And this yielded an initial list of 26 items. The team then reviewed these items and eliminated those that were obviously repetitive, redundant, or unrelated to systematic reviews of health policy and systems research. And this reduced the number of items from 26 to 19. And these 19 items formed the preliminary tool. For content and phase validity, we sought input from different groups that included experts in systematic review methodology, experts in health policy and systems research, as well as policymakers in the health domain. And these constituted over 40 individuals, and we asked them to provide inputs on the clarity of the items, the redundancy, the need to add or delete any item, or to merge any of the items. And these are photos from some of the group sessions that we held. As part of the pilot testing phase, we tested the tool through interviewing a purposive sample of 3 international experts, followed by pilot testing with 3 policymakers. Participants suggested rewarding a few items to enhance their clarity, but there were no suggestions to add or delete any of the items. So the current PARC tool is composed of 2 modules. Module 1 includes 13 items to be rated by policymakers and stakeholders, and Module 2 includes 9 items to be rated by systematic review teams. And the recommended approach for administering the tool is for policymakers and stakeholders to complete Module 1 in order to rank the review questions according to their relevance. Module 2 is then applied to those relevant questions in order to rank them according to the feasibility and appropriateness of conducting a systematic review to address them. However, in some cases, the order of administration can be reversed. For example, when there is a relatively large number of systematic review questions to prioritize and time constraint for policymakers and stakeholders. So I just want to mention that this tool is freely available for use and pilot testing by any one of you, and this is the first version, and we might end up having another version. The final point is that each item in the tool, we rate it using a 5-point Likert scale that ranges from strongly disagree to strongly agree. I will now give the floor to Dr. Elie to introduce you specifically to the different modules of the SPARC tool.
Thank you, Rasha, and hi again, everyone. So as Rasha explained, we took the tool through a thorough process of development and initial validation, but we're still calling it initial validation because we feel that there might be some future revisions, improvements, or refinements to the tool. And in fact, the manuscript describing the development and initial validation has been conditionally accepted, and we hope to be able to publish it soon. So if there's any major issues that communication, looking for opportunities to collaborate in order to refine the tool and improve it in terms of presentation, content, and use. So Rasha already mentioned that taking the tool through the process, we had initially one list of questions, but one of the things that became evident is that there's the concept of relevance of the question for stakeholders and the concept of feasibility of the systematic review for that for the team. So that's why it's split into 2. So what we're going to do today is show you the elements of the tool module and ask for your feedback, whether there's any question that is unclear, whether there are redundant questions, relevant questions, or any missing questions. So before we move to that step of reviewing the specific items, we're going to open it now for any questions or comments about what we've mentioned so far.
So if anyone has any questions, please raise your hand. Thank you. Okay, so we have Sudhakar.
Yes. Can you listen me?
Yes.
Okay. So my question is that this prioritization tool, now it is a very good that relevance to the policy makers and the 9 questions for the feasibility for systematic review. Will you be circulating these things to the webinar people, all the slides and other instruments? Okay.
So we'll do that today.
Hello, there is some problem. I could not listen properly.
So you can't hear us well? Okay. So yes, so the answer was yes, we will share the tool after the webinar. So we will share them with everyone following the webinar. Was that clear? Okay. Any other questions or comments? Okay, so let's start with, we'll show you now the tool. So this is the first module. This is the module that is focused on the relevance of the question to policymaker and stakeholder. And again, as a background, the way it would work is that there would be a number of questions. For each of the question, we would apply the tool for each question separately. So we would be answering these questions or creating those statements for each systematic review question separately. So this will give us an idea about the level of priority for each of the questions. So, so we have for the first module, we have 13 items. Again, these are addressed to policymakers and stakeholders. Typically, the way this would work is that we would have a priority setting meeting where we would gather stakeholders and policymakers, would present the question, and would ask them to answer the question, the 5-point Likert scale for each of these questions. So I'll give you a minute to look at this list of 13 items. And then we'll open it for discussion to get your input about whether any of those items is unclear, whether there's any redundancy, or maybe there's some irrelevant item or some missing item. Okay, so please, if anyone has any question or comment, we could start discussing any of those items. Again, we're looking at whether any of those is unclear, redundant, irrelevant, or maybe whether there's any missing item. And you know, the other way is if you want to type in your question, please use the chat window. Okay, for those who might have just joined, we're reviewing the items of the Spark tool. A quick reminder that the Spark tool is designed into two modules. Module 1 is targeting policymakers to get their input on the relevance of the question being considered for the systematic review. And we're now reviewing this first module. The module 2 will be addressing the feasibility issue, and it would be filled out mainly by the systematic review team. So we're looking for your input on whether there's any unclear item, redundant, irrelevant, or maybe some missing item. So, so if anyone could let me know, does this list make sense? Okay, so maybe what we could do, oh, okay, there's someone. Okay, Jagnur, did you want to make a comment?
Oh, yes,
or maybe it was
yeah, I typed it in, but my comment was actually about two things. Just going to the list from number 9 onwards, it says acting upon the research evidence. So I wasn't sure. To my mind, acting upon is quite wide, broad term. So I was trying to know what does that really mean. And the second question was regarding item number 13. If you could explain that a bit more. Perhaps I haven't been through the tool notes and that would clarify it, but just looking at this list, these are the two things that kind of struck out.
Yes. So just to make sure I didn't miss any of your questions. So the first one was the general question about using acting upon the research evidence in questions 8 through 13, correct?
Yep, 9 through 13.
9 to 13, yes. Yes, so you know, we struggled a little bit with how to frame those statements. So just to give you a quick background, when we started, these were questions. And then we're supposed to answer yes, no, and then through pilot testing we turned these into statements where, as you've seen, there was a Likert scale. We would have to give a rating on the Likert scale to agree or not agree with the statement. And then the question was, is it that you know, doing the systematic review would impact, for example, equity on health, or actually getting to the point of acting upon the evidence? And we had some comment that sometimes it's not enough to have the evidence, and we have to think whether people would actually act upon the evidence and how would that impact. So the main comment was to think about the downstream, not just about having the evidence, whether actually acting on the evidence would help. So it was more a presentation issue.
Okay.
So that's Yeah, so that's the concept of, the having the evidence is not enough. So sometimes you do have the systematic review, but what's the impact of acting upon it? That makes sense because, again, we during pilot testing get different opinions and suggestions. The way it is written now, acting upon the research evidence, is it, do you think it's confusing? Could it be improved?
Yeah, I would probably need to read it better, but yes, acting upon to me seems quite broad. I mean, even from a policymaker's perspective, acting upon could just be having multiple meetings or doing nothing, just learning about it. So I don't know what really act upon means. So, well, I will have a bit of think about it. And a similar thought was around the question number 13 as well, because it's a Likert scale. What happens if somebody says it is high on the health target but low on the overall development of the country?
Mm-hmm.
So, and perhaps for that I need to see how it's scaled or how it's weighted to understand that better. So it was just a remark that I could give based on my quick impression on these 13 statements.
Yeah, the scale, just to show you the scale on the previous slide. So for each of those questions, the scale would be rating the agreements. So one more.
Oh, okay.
So we would say strongly disagree, disagree, neither agree or disagree, agree, and strongly agree. Obviously, this still, the question remains about whether acting upon is the best terminology. Yeah. So, and then, the question 13 about the overall development of the country. So the concept is that a country's overall achievement in social and economic dimensions are sometimes based on health to some extent. So you improve health, and doesn't just improve the health status, but it improves the overall, it has implications on social and economic dimensions, and improve the overall development of the country. Again, this might sound, a bit far-stretched. The approach we've adopted in this development is to take most of the suggestions, consider them, and some people had these suggestions to think a bit long-term in a more general term. So we've accepted the fact that, okay, let's include them for now and have more actual use of the tool. And then with the use, we would be able to identify whether some of the items are actually irrelevant or too hard to implement.
Certainly.
So that's kind of the approach. So what we say, actually, if someone is interested in using this tool, I think it's totally legitimate to say for my audience, this might not be clear, or this is not relevant because my audience, I'm working with on a smaller jurisdiction where we're not really worried about the overall development. So I'm going to skip that question. So it's kind of a more inclusive menu of questions or of statements that people might choose to choose fewer items than what is presented.
Sure, thank you.
Thank you. That's very helpful questions. So next we go to, just one second. Yes, Sudhakar.
Yeah, I heard some explanations what you've given, but there are some like question number 11, acting upon the research evidence for the question is expected to have the positive impact on patient experience of healthcare. So this is also a very general thing, and we may not be able to do either from world country or within the country. There are a lot of variations, socioeconomic, cultural, and other variations. And also the caregiving is different at different regions. So that also we have to just look into. I think this has to be tested in many.
Sudhakar, I'm sorry, the line is cutting off. Sudhakar, do you mind, because personally I can't hear anymore, not sure what the problem is, do you mind typing your question? So I know you're talking about item number 11, patient experience.
Three high-level people, and they want this priority setting questions tools to be experimented with them, so that I'm going to have a this is a very important tool to use when I'm going to have a meeting with them sometimes in September. So by the time, I think it will be quite refined and will be shared with us.
Yes, so Sudhakar, I'm sorry, but for some reason the line cut off for a few seconds. What I got, and please rectify me if that's not correct, is that you are asking about question 11, and then you are mentioning an opportunity to experiment with this in your own setting.
Yeah.
Yes. So so let me start with item number 11. Again, so the concept was to identify or to rate the relevance of the question. And one of the components that came up is this issue of impact, what will be impact on different components. So equity was an obvious one, the health was an obvious one, the expenditure was an obvious one. And then these two items, 11 and 13, were the kind of items that people have suggested and thought that this would be kind of progressive kind of thinking, and we end up including those. So I already discussed number 13. So number 11 is the concept of patient experiences that many organizations are trying to push. And even so, the argument for this item is that even if this is a health system level of intervention, we have to think that whether eventually it could improve patient experience the way we are changing the system. So that's kind of the concept. I'm not sure whether that addressed your question or concern about this item.
Okay, I'm also very sorry because Ethiopia is very. I also lost the connection, and now I could listen a little bit.
Okay. So the other point is, yes, people we are very happy for people to take this and experiment with this. If they think there's an opportunity for them to do some studies around it and publish on it, that's also fine with us. You know, our main aim, so this came out of a challenge for us to, when we did a priority setting exercise about 3 years ago, we really struggled with how to frame the questions for the policymakers about what we are exactly looking for. You know, we are mostly on the systematic review side. We do have policymaking expertise, but wanted to bridge that gap, and that's how this came out. So if people can use it for that purpose, we'll be happy. Okay, thanks, Sudhakar. And I think Benjamin, yes. Benjamin, please.
Yeah, I think just to say that the tool makes sense to me, and it's a very good approach to bring in some sort of structured way to approach the priority areas. My comment is about the bolded words, which to me, I think it implies that those are the key words and key themes that need to be considered. I see in the next slide, you've given sort of some pointers. For example, large burden driven by both prevalence and severity. So my suggestion is that to probably guide the users, maybe for each question 1 to 13, you could consider having kind of these pointers to help users be able to know what kind of considerations they need to make with regards to the bolded stuff, because as you can see, a lot of it, there's a lot of qualitative subjectivity could easily creep in.
Yeah.
And you'd want this to creep in when the audience or the users have really mastered the use of this tool.
Yes.
But if they start using it now, you could have a lot of disagreement coming up because of just differences in how you interpret what are the national goals, as an example.
Yeah, thanks, Benjamin. So first, thank you for the positive feedback and for the excellent comment. What we missed to mention is that along with this tool, we have a manual that includes some of these explanations about each one of these. And again, we'd be happy to share those. I think one of the suggestions, along with what you have suggested, is to have signaling questions. So for the problem is so for example, item number 1, the problem is of large burden. The signaling question would be, what is the prevalence of the disease high? Is the burden of the disease high?
Yeah.
So this is one of the considerations. So we do have some of those, kind of signaling items, but we might decide to make them more formal.
Yeah, and I guess also alongside that, you probably need to, if maybe you haven't, perhaps consider, having a system to collect the challenges from the users once the tool gets rolled out for the greater audience, and in that way you will be able to pick up where there could be problems in even following those signaling questions.
Yes, so you mean later on with the use, collect kind of continuous collection of feedback.
Yes.
Yeah, definitely. Yeah, thanks, Benjamin. Okay, so I think that's very helpful. And again, it validates what we've had in previous feedback, that it's the wording is always tough. It's always tough to get the correct wording. Is it acting about the research evidence, or is it getting the research evidence? And that might affect the judgment and the interpretation. So and hopefully with more signaling questions and explanation, that would be more obvious. So now we'll move to the next slide. So module 1 was about the relevance questions. Module 2 is, is it feasible? So sometimes you have a highly relevant question, but it's like when you do a systematic review and you end up with an empty systematic review. And the question is, was it worth it? So it's kind of similar in this case with module 2. It's about the feasibility and whether the systematic review team will end up with some relevant product. And an ideal question would score high on both. It's highly relevant for stakeholders and it's feasible from the systematic review kind of perspective. So again, we'll give you maybe a couple of minutes to go through the list and then give us your input on that list, if there's anything unclear, if there's anything that is redundant, maybe irrelevant, or maybe a missing item. Okay, so Jagnur, please go ahead.
Sorry, actually, I'm going to take a step back over here because I had that concern even with the previous slide. So as I understand from the discussion so far, you are trying to curtail the subjectivity around the language with some detailed notes. However, when we are talking about health systems, I'm just trying to understand the boundaries for the Spark instrument. When we talk about health systems, it goes beyond health. And some of the questions, they are very, very specific to health. For example, impact on healthcare expenditures, for example, number 12. Now, if you have to take road traffic injuries, a systematic review on perhaps helmets and reducing traumatic brain injury, or something around alcohol abuse and drink driving might be useful. So that would be more for prevention angle. So is Spark meant only for interventions, or can it be more broader to include prevention as well? And to my mind, when we are talking about health systems, it should perhaps include all of that. And a similar question to my mind would be, for example, with burns, where we can talk about health systems with respect to equity as well as expenditure, since there's a prolonged disability, but it might not be an institutional healthcare system and more of a community healthcare system for prolonged disability in a low middle income country, which is just not accounted for. And where does Spark fit in there? Or is it just not, or Spark, it's not within the aim of this tool to include prevention and perhaps rehabilitation where it's not directly linked to health? Does that make sense?
Yes, a very clear question. So when we define the scope, this is how we define it, is about, questions for systematic reviews. So it's not for doing primary research. It's not for, making health decisions. It's more questions about doing systematic reviews, because sometimes priority setting exercise for either doing primary research, so that's a clear difference. But then sometimes there are priority setting for, okay, we have money, what do we spend it on in terms of health system? So this is more on the action side. So this is more on the systematic review side. So this is the first kind of frame. The second part of the frame is about health system. So anything that is related to systems in terms of organization, financing, human resources for health, etc., governance, etc. So we did not at any point think it would be restricted to prevention or rehabilitation, but we're interested from your perspective looking at this, and obviously you sound like you have experience in those fields. Would that be applicable? Do you see any problems with applying those kind of questions to the prevention or rehabilitation fields?
Yes, I think this would need to be scoped differently if we are trying to include those two as well, and it might be just adding an option depending on what the relevant question is. So if it is a clinical intervention question versus prevention, the words might need to be played around with. That's my feeling looking at it.
Yeah.
And as you said, it's very difficult to word things. So we can make it as complicated as we want, or we can make it very narrow or broad in scope. So I'm sure you guys would have had some discussion around it. But from my perspective, for example, if I want to use it for a systematic review or health system approach to improve recovery in burns victims, I would probably struggle with these questions, taking it to a policymaker. And I can perhaps give you a better feedback through an email. I would like to think through it, and I'm happy to pilot it as well and give you feedback.
Thank you for that. And Rasha?
I think you might be a bit right, because as Dr. Ali mentioned, this tool focuses on health system, and we define health system according to the McMaster's definition of health system, which divides it into governance, financial, and delivery. So it's a subsection of public health. So we're not looking at the entire public health, we're looking at the health system aspect of this broad umbrella. So clinical, it's different. Public health, it's the broad one, and we're looking at health systems. So yes, I agree. Some of them might not applicable to public health since it goes beyond the health sector. And of course, we're happy to receive your input more.
Yeah, certainly. That's the reason I wanted to ask you about the scope, because that's my understanding of health systems as well, that it goes much further than just what happens within a medical facility or a health facility, and that was the reason I asked that question. Yep, I would be very keen on looking at rest of the documentation that comes along with the instrument, with the tool, and provide feedback.
Yeah, Thanks, Jagnur. Yeah, so to follow up on Rasha, so if there's a question about using, this kind of medication for burns, that wouldn't be applicable. If it's about starting, providing free coverage for patients with burns, that's probably when this tool comes in terms of then questions about equity and healthcare expenditures become more relevant.
Absolutely, that's what I was looking at. That's exactly what was playing in my mind.
I think we should better define what we mean by health policy and system. Maybe it would clarify things.
Yeah, I think it's in the manual we do that at some level. Yeah, and hopefully when we send you the manual, it becomes clearer.
Sure, certainly. Thank you.
Yeah, thanks. These are very helpful questions, in fact. So we'll go back to the next slide. Again, the next slide was about the systematic review perspective. And again, here it's, we've decided that it is a relevant question from the policymaker perspective. The question now, can we do it, or should we do it from a more technical point of view? So you can see there are questions about, whether it's an answerable question, because sometimes, you have policymakers, because that's, we're talking about different worlds. We need to make sure that it's an answerable question. And in the manual, we do mention different ways of framing questions like PICO and SPICE, etc. So any quick thoughts about the list, or any item that feels a bit off or inadequate or maybe missing? Okay, so actually we did have some questions. We had prepared some questions where we thought we would benefit from your input after considering Module 1 and Module 2. So the first question, and actually this is a question we've received recently in the peer review process. When Module 1, the first question, the problem is of large burden. And going back to, I think what Jagnur was saying, thinking from a health systems perspective, the question is, how would you define burden as it relates to health policy and systems research? Is that different than the burden when we think about it from a clinical or public health perspective? So any thoughts on this would be appreciated. Yes, Jagnur?
Sorry, it's going to be me again. Yeah, from health perspective, I think we often tend to put it in terms of death or disability or number of days of hospitalization. So those are very, very typically health one. To my mind, if you're talking about a large burden, it includes economic and social burden. And social burden is something that I'm sure it would have been in discussion, is difficult to capture, but nonetheless important to capture. Health economics has gained some momentum, so perhaps that is something that is easier to define. So as much as I say it should be health, it should not be only about the outcomes with respect to health. It should be also social and economic. I do realize that there could be some challenges in defining all those concepts in quite a few settings.
Yes, yes. So economic, that's easy for me to process. So when you talk about social burden, could you please expand on that?
Okay. For example, I was involved in a study recently looking at burden of impact of road traffic injuries, and there is death. For example, of a young 17-year-old male. And from a health professional or public health perspective, it is recorded as a death and that's the end of story for us. But if we start looking into social impact through, for example, qualitative measures, what we find is that there's an ongoing depression with the mother. The father has turned into alcoholism, and there are 3 sisters who had to drop education and get onto work. So that is kind of a social impact where the whole family fabric is breaking. And it is difficult to capture, as I said, and it is difficult to quantify, but nonetheless, certain conditions have young deaths, young people die, and it has a different impact to some other conditions.
Okay, yes, that's a good example. Yeah.
So when we talk about health systems, there's a bigger impact to just a road traffic incident. That's what I was trying to highlight when I was talking about social impact. And I understand there are certain tools regarding social cohesion and social impact that have been propagated by WHO. I have not used them, but I believe there are some that have been used and have been able to give a certain score, which can be translated in terms of burden.
Yeah, and the challenge, as usual, in the health system field is, what is public health versus what is health systems, and some of these, I guess, are common to both.
Yeah, true.
Yeah. Okay. Thanks again. So Benjamin.
Actually, this is more of a question than a comment. Just following up to the previous speaker. For example, in Africa, we've got huge stigma around HIV, and if you to define large burden just based on the prevalence and severity, we know that there is a lot of social, which is related to stigma around the disease. Would that be fitting to what the previous the previous person talked about in terms of social as a burden?
Definitely this sounds like a burden. So do you think this is more of a health systems or a public health kind of burden? Again, it's might be one of those. It's hard to, yeah.
Yeah, I'm actually not sure. Yeah, it's more of a question actually than a comment.
Yes, no, but yeah, definitely one thing to consider in terms of the burden. Yeah. Thanks, Benjamin. Okay, maybe we could go to our next question for you. So we had this question about from Module 1. So keep in mind that Module 1 is a relevance of the question to policy making. And we had item number 7, there is moral obligation to use the research evidence for this question to inform decision making. So the idea behind this question is that sometimes you have to use the evidence, because if you don't use the evidence, there might be long-term consequences, because this is a major decision that is being implemented, let's say, long-term on a large scale. And if it's not based on evidence, and if it actually harms more than it benefits, it is a moral issue. And then there are some views that this is maybe too complicated to think about in terms of moral obligation and in the sense of using a systematic review. So we thought maybe we could do a quick poll just to see what people think. And then you now have the chance to vote if you want to do this. And maybe we could have a quick discussion. So we have, yeah, people are voting. Thank you. It's nice to see the percentage of voted going up. Still going up. Okay, so yeah, if we could have a few more votes. Okay, okay, so we have, I'm not sure whether you could see the results. Can you see the results of the poll? Okay, so what we had is 100% yes for keeping this question, so I think it's a clear yes. Does anyone want to comment on this before we move on? Okay, this is the 100% yes, so we're happy to hear about this. Thank you. Okay, so now let's go to the next question that we had. It's fun to have these poll things. Okay, the next question is from Module 2. That's targeting the systematic review, and the question is, conducting the systematic review is a social responsibility. It's kind of similar maybe to question 1, and so one example we had is the issue of, for example, interactions between physicians and pharma. This is an area where we worked on. So the systematic review team felt it is a social responsibility kind of concept to do the systematic review if policymakers are not interested, because from our perspective, we think it's important for it to be the basis for any policy making, or maybe at least to place the issue on the agenda. Because if the policymakers are not even placing it on the agenda, the systematic reviewers in some cases find themselves having to address topics just to place them on the policy agenda. So this is the background for why we had this. We're going to have another poll for this, and depending on the results, we might or might not have a discussion. Okay, I think this time we are quicker at answering. Maybe it's an easier question. Jagnur, did you, I'm not sure that you have your hand up.
Yes, I was just going to quickly expand to your comment about putting some of the research questions on the agenda. Is a part of the social responsibility is also ensuring that there is less waste, and that waste, research waste, could be from multiple perspectives, and that was the only thing I was trying to add. Not very relevant, perhaps.
No, that's helpful. Thanks, Jagnur. So these are the results of the poll. A vast majority says yes, we should keep this question. Not sure who was uncertain, but if anyone wants to comment on this, please go ahead. Just show me your hand. But overall, people feel that we should keep it. Yes. Is it? Yes. Is it Ndali?
Yes, my name is Ndali from Ethiopia.
Yes.
Ndali from Ethiopia.
Yes, hi Ndali.
Are you listening?
Yes, yes,
yeah,
we can hear you.
I mean, I was answering because in the previous question, there was about issue of moral obligation. And I thought this would be similar with the first one, with the previous one, the moral obligation.
Yes, that's true. And this is kind of the comment that comes up. In fact, the way, so going back to the way the tool is implemented, it's typically implemented in 2 phases that are separate and distinct in time and place. The first phase is where you get the stakeholders sitting around the table, you give them the tool, and you ask them to give their input. So this is where the first question comes up about whether it's ethical to ask the question. And then from the policy perspective, and then it goes, so those questions that are typically rated high on relevance go to the systematic reviewer. Typically, that's how it would work. So that's why there are two questions. And again, people could argue that this is mostly a question that should be addressed by the policymakers and not the systematic reviewers. And that's where the discussion starts. So what's your perspective in Dali? Does that sound redundant, or should we still give the chance to the systematic reviewers to make that judgment?
Okay, I agree now. I agree.
Okay.
We can keep both of questions, both two questions. Yeah.
Okay. So may I ask if you are the one who was uncertain?
Yes.
Yeah. Okay.
Yeah, we are listening to you in group of 3.
Oh,
and,
okay.
I'm the one who is uncertain view on that.
Yes. Thanks. Thanks so much. Okay. Happy to have everyone listening in. Okay. So maybe one more question we had.
Okay, so this is a suggested item to add to Module 1. It's whether receiving the research evidence for this question is urgently needed to inform decision-making. So we want your input on whether to keep it, because we wanted to see if you think it overlaps with item 6 of Module 1, which is receiving the research evidence for this question is critical to inform decision-making. So one of them is time-sensitive, and the other is not time-sensitive in a way. But we would like your input. So does the item receiving research evidence for this question is urgently needed to inform decision overlap with receiving research evidence for this question is critical to inform decision? So urgently needed versus critical. Do you think these two overlap, or we can keep them separately?
Okay, so we have about 50% who voted. Percentage is going up. 58%, it would be good to have a few more votes, even if you are uncertain. I think that's fine, because some of these questions are challenging. Okay, so here are the results. So this is really all over the place. I think one of you had mentioned that sometimes it's the wording that is tricky. So is it critically needed, urgently needed, or critically needed? So, Indali, did you want to comment on this? Or was it your hand up for the previous question?
I don't think I clicked that now.
Okay, that's fine. Okay, so I think it's already at the top of the hour. So we would like to thank you again for the feedback and for the input. So what we'll do will be emailing you the copy of the tool and of the instructions for using it. As we've mentioned, we hope to get this published soon. But we're looking for opportunities to collaborate, and we're happy for people to use it, whether it's within or outside research. And if and when you use it, it would be great if you can send us your feedback. Thank you, everyone, and hopefully we meet soon at some point.
Thank you, Eli. Thank you, Rasha. Thank you, everyone, for joining us today on the webinar. And don't forget, there is another session on July 28th, and the recording will be available along with the notes. And Spark team will be sharing the full tool with whoever is interested, and we'll send it to all registered people. Thank you.